Welcome to Final BDS Made Easy. In this video, we are going to discuss the 1 markers from the subject of oral surgery. First question is EMLA. EMLA stands for eutectic mixture of local anesthetics. It is a topical anesthetic cream composed of lidocaine and prilocaine used to numb the skin before procedures such as injections, blood draws, or minor surgical interventions. Second question is battle sign. Battle sign, also called a mastoid ecchymosis, consists of bruising over the mastoid process behind the ear due to bleeding from posterior auricular artery. This sign is an indicator of fracture of the middle cranial fossa of the skull. It may appear a day after initial head injury. It should not be confused with the hematoma due to condylar fracture. Which movements are used for extraction of mandibular first molars? Buccolingual movements and removal in the buccal direction. What is the maximum administered safe dose of lignocaine 2% with adrenaline? The maximum administered safe dose of lignocaine 2% with adrenaline is 7 milligrams per kilogram with a total maximum dose of 500 milligrams for an average adult. The question is the composition of Carnoy solution. It consists of 3 milliliters chloroform, 6 ml absolute ethanol, 1 milliliter glacial acetic acid, and 1 gram of ferric chloride. Sixth question is osteotome. The osteotome is similar to a chisel, but the edge of the working tip is bibeveled, which converges to sharp edge. Flat end is stabbed with mallet to split the bone. It splits bone rather than cut or chip the bone as with the chisel. Uses are various osteotomy procedures or refracturing malunited fracture, biopsy of bony lesions, and removal or recontouring of the bone or osteoplasty. What is the ratio of chest compression to mouth breathing in CPR? The ratio of chest compressions to mouth breathing in CPR is 30:2. This means 30 chest compressions followed by 2 rescue breaths. What group of drug abusers are known as walking time bomb? Amphetamine abusers are known as walking time bombs due to the severe cardiovascular and psychological effects of the drug, which can lead to sudden and unpredictable violent behavior or medical emergencies. Alkyd-Bramley incision is a modification of the preauricular incision specifically for better access and reduced risk of facial nerve injury. Waldron's procedure. This is a two-stage technique. First, marsupialization is performed, and at a later stage, when the cavity becomes smaller, the procedure of enucleation is performed and the entire tissue is examined histologically. Next question is panda faces. Bilateral circumorbital ecchymosis is also called panda faces. It is seen in Leaford fractures. Next question is cold sterilization. It refers to the process of sterilizing instruments using chemical agents such as glutaraldehyde at room temperature without heat. It is commonly used for heat-sensitive dental instruments to prevent damage while ensuring sterility. Number 13 is most commonly used suture in oral surgery is the absorbable suture material, specifically the 3,0 vicryl, also called polyglatin 910 suture due to its predictable absorption profile and minimal tissue reaction. Next question is enumerate principles of elevators. There are 3 principles: lever principle, wedge principle, and wheel and axle principle. That's it. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Stay tuned for more such videos.